Recording. Okay, we'll go ahead and get started. So in this module, a brief introduction. We have discussed how team-based care leads to better outcomes, creates a better experience for staff, and one of the most effective things that you can do to improve all aspects of care delivery. It affects several measures, including office visit time, access to care, preventive screening, self-management, goal setting and planning, and medication reconciliation. The task includes improving processes and workflows, ensuring staff work to the top of their licensure, and sharing accountability for care delivery. Responsibility for care delivery currently lies with providers, and a provider's comfort with shifting responsibility may be challenging. Advice is to start small. This module builds on the First Things First Getting Started module, that first one that we reviewed in the program, where we covered first steps of implementing team-based care. In this module, we will review more advanced steps for enhancing the team. So we'll begin with expanding and strengthening the team. So enhance teams for efficient and effective coordination to meet the needs of the patient and family. Additional staff can strengthen the care team. Some practices have found it useful to include a pharmacist, behavioral health specialist, diabetes educator, or health coach on the care team. Revisit huddles, processes, and communication flows, and consider adding to the care team to help improve communication. Revise workflows to clearly map the roles and responsibilities of the care team members. Add new staff if possible to redesign roles and responsibilities. And encourage all care team members to attend daily huddles with flexibility to accommodate their schedules. And we have included 2 links that contain more information on adding those roles to your team. Some ways to enhance teams for efficient and effective coordination. Include individuals who interact with patients and families directly and indirectly. Co-locate care team members for improved communication and coordination. Huddles for care planning each day, and using huddles to make adjustments for unexpected situations. Cross-train staff to adapt to demand variation and introduction of additional services. Maximize the medical assistance role. You can also use scribes to improve providers' productivity. And look outside of the organization for team members, again, such as community health workers, peer advisors, medical, nursing, or pharmacy students, public health nurses, and community agencies. You can also add team members to help address specific population needs. As mentioned before, integrating behavioral health. You can integrate oral health and pharmacy through a staff model, co-location, or contract relationships. Use messaging to communicate with the team. Define roles and distribute tasks among team members. And using decision support and protocols to manage workflow and address chronic and preventive care. Enhance team resources with staff such as a health coach, a nutritionist, behavioral health clinician, a pharmacist, and physical therapist. And you can also monitor and reward compliance for participating in the huddles. So give teams designated time to develop those relationships and budget for team building activities. Consider a line of sight and care team space, such as colored flags on rooms to communicate with the team. Next, we'll talk about defining the medical neighborhood. Establish medical neighborhood roles, establishing clear expectations among primary care team specialists and others in the medical neighborhood about the role each will play in a patient's care and what information each will share. And community collaboration, identifying and collaborating with community partners to enhance service offerings and patient and family engagement. The medical neighborhood supports both medical and social aspects of managing the community issue of health. And optimizing the care team requires collaboration and exchange of information among clinical partners. These may include specialists, home health, long-term care, and hospitals. Non-clinical neighbors may include community centers, faith-based organizations, schools, employers, and public health agencies. All of these address community health needs. Define the medical neighborhood with which the practice works most closely. Develop personal and electronic relationships to ensure information sharing. Develop formal written agreements and formalize lines of communication. Ensure that useful information is shared with patients and families at every care transition, and engage payer, disease management, and care management staff to help avoid patient and family confusion. And also learn how to contact community partners, make appropriate referrals, and assess patients' use of community offerings. Develop formalized relationships for sharing useful information. And there are 3 resources included on this slide. Findhelp.org search tool streamlines care management and helps providers connect patients to local social services. A community resources directory template for collecting and organizing community resources. And uniteus.com provides a platform to connect patients with community-based resources. And work with community agencies to enhance services available to patients. Use community health workers or peer advisors to provide self-management support. Engage with churches and schools to develop joint programs. Engage with rec centers, be familiar with the behavioral health crisis response in your community. So again, having those relationships with different behavioral health centers may be very valuable to your patients. Develop joint programs with community agencies and have employees assist in developing worksite health programs. And create a community resource document to share with your patients and their families. Clarify team roles. Define, distribute, and document the roles of all care team members to maximize skill sets, training, and licensure certification. Communicate roles to patients and families. Leveraging the expanded team can help improve planned care and continuity, patient and family engagement, clinician accountability, and communication within the medical neighborhood. For example, including a pharmacist can play a central role in medication management and monitor contradictions or overuse with medication. They can also develop a medication care plan for your patients. And some steps that you can take when leveraging the expanded team are to identify your champions, inventory the work, process mapping, link work to the strategic plan, and assess staff for readiness. The toolkit included on this slide will help identify who to include as a team member. And some suggestions are to inventory the work to be done prior to a patient visit, during a visit, and after. Determine who can do each part of the work by matching their training and skill sets, and use process maps or swim lane diagrams to clarify responsibility once roles are assigned. Identify staff interests and talents and align with available opportunities. Add fields to registry or to the EHR to capture the care team member roles, and share team roles with patients and families on paper and electronic systems, and empower medical assistants with coaching skills so that they can expand their role in supporting self-management. Next, we will talk about optimizing continuity. So optimize continuity so both patients and care teams recognize each other as partners in care. Doctors who work alongside care team colleagues in busy clinics may encounter patients that they have never met before. They must rapidly learn the patient's history and address the patient's current problem. Seeing the same care team each visit results in a better standard of care with a more satisfactory consultation for the patient and the doctor. And paneling patients or linking them to a care team leads to continuity. And the two links on this slide are resources to help with panel management. And some suggestions: measure and monitor continuity between patient and care team regularly, and develop a script to assist schedulers in providing appointment options with the care team. Provide medical record access for after hours and direct secure messages to and from emergency departments. And share information electronically to reduce duplicate information and tests. For specialty care, assign accountability for each patient to a care team and ensure coordination with the primary care team. And next, we will talk about involving patient and family members on the team. Actively engage patients and families to collaborate in goal-setting decision-making, health-related behaviors, and self-management. Including patients and family members in their care improves the quality and delivery of care. Patient and family engagement develops communication and establishes trust in the patient-doctor relationship. To effectively engage and hear patients, you can include them on key committees, organize focus groups, and can include a suggestion box in the office, conduct walkthroughs, and ask the patient what they care about or about any concerns that they may have. And on this slide, there are, again, two resources that will help enhance patient engagement. And here are some suggestions. So training staff in motivational interviewing approaches, create a shared care plan for every patient, using evidence-based decision aids, share test results and educate patients on those results, and include patients and family and care plan and documentation in the EHR, goal setting and follow-up using teach back, action planning or motivational interviewing, and using tools to assist patients in assessing their need for support with self-management. And the link for patient activation measure provides more information. Okay, and those are all of the slides that I did want to go through with you. So we can now open it up to kind of talk about anything that you may be doing as far as, connecting with your medical neighborhood or involving the patients and families. I know we've talked a lot about patient and family engagement and There are so many different methods that you could choose from to really build on that. So I will open it up if anyone wants to share any feedback or anything that they feel they're working toward in those areas of late. Or if anyone has any questions or feedback about the slides today.
I'll just say that I guess in my office, I'm very thankful that we do have a mental health provider for the pediatrician, I mean, for the patients in the practice. And that I think we've had her for about a year, and she's through Boys Town Behavioral Health Clinic. So that's really been wonderful for our patients because there's the waiting lists are tremendous for other resources, and it's wonderful that she's able to come once a week and serve our patients in that capacity. So that's one thing that we are doing to kind of reach out to the community and bring, kind of create a team. I guess something else would be, I guess just getting to know the medical assistants in my practice and what their strengths are. There is someone here who's really helpful with VFC, the vaccines for children, and coordinating what needs to be done with that. I've learned to delegate, especially in a small practice. I can't do everything. So finding what their interests are and what they're good at has been really helpful. I think, I still do have to work on praising and encouraging them and letting them know that they're, doing a good job. But I definitely think that, my medical assistants are cross-trained at the front and the back, and that's a necessity. Yeah, I think that's about it.
Yeah, those are wonderful, wonderful things to have going on. I mean, the medical assistants can help out a ton. And as you just shared, I mean, it certainly has an impact on the practice. So it's really figuring out, like you said, where their strengths are, where they can, lend some assistance, because it's hard when you are a solo provider or a smaller practice to really try to do everything. So those people are definitely valuable. And yeah, thank you for sharing your feedback. I know you're incorporating the mental health too, which is such a need. So it's good to hear.
Yeah, I think it's great you have a mental health resource like that, because what we've heard is that especially in pediatric, there's a real shortage of behavioral health providers for pediatric patients. So that's great that you have a resource like that.
Yes, and a great need, especially, after the pandemic. So
Yeah, absolutely.
Yes, I've read articles that it has much more, it's had a lingering effect on children.
Well, thank you again. Let's see. Paula, did you want to share anything regarding this training?
Sorry, I was having trouble finding my unmute button. Not specifically. I mean, we do some of the things that people have said. We have a relationship with a mental health, but we just have a referral to them. They're not in our office. In our office sounds great, but we don't have that.
Right. So you do have that.
We have a relationship. Yeah, and we follow up with them, and they keep us informed as to when they get the patients in and everything. It's worked out well.
Good. Wonderful. Yeah, it's certainly great to have like within the practice, but you know, whatever works for your practice. I mean, having that close relationship where there's a mutual understanding of open communication, especially, certainly helpful. So that's
It has
great.
been.
Thank you. Um, Dr. Merritt, I don't know if you can hear, or if you have audio, if there's
Yeah, I can hear
anything you
you.
would like to comment on about this module. Oh, hi.
Yeah, and I think we have a new manager on our team, Stanton, who I think was at least on audio um, with our team. And yeah, I think yeah, we don't have, I mean, in terms of the relationships and ancillary professionals, we don't have anything in-house right now. I think we've looked at some solutions, and there are even like electronic options to work with vendors to do telehealth. And I don't know, I think my limiter has been just understanding what would make the most sense for the practice that's going to balance being easy and adding some value for the patients and providers and not just being extra work.
Right. Yeah. It is certainly a balance, and really, again, like assessing the need to make sure that it's being handled in the way, because of course each practice is so different and the needs change too. So you know, depending on what the current issues may be, and as we just mentioned with COVID, I mean, mental health need has increased because of that. So well, thank you for sharing that. And we did get to meet Stanton, so it's very nice to have another member participating in the program.
Yeah, so glad. There he is. Hello, hello, hello.
Well,
Yes. Awesome. Yeah, I just hopped on at like 2:03, so you guys had started, but awesome.
Well, thank you so much for your
Mhm.
feedback. And let's see. I think we just have the three of you on the call today. Melanie, is there anything you would like to add to the slides that we reviewed?
I mean,
know
not
a lot of
necessarily to the slides. I just wanted to make a couple kind of a couple announcements as we close out the call today and ask for a couple things. So were you done with the part you had prepared, or do you want to go? You're going to go through the change concepts?
No, so I actually
You
put
did
those
everything together.
into
Okay.
yeah.
Okay, so just a couple things for practices. I guess one is a request and another is an informational piece. So as the program closes out, we would love to hear from practices, just kind of like one or two sentences about how the benefits that you got out of this program. And this is in addition to kind of the formal feedback that you give as part of the assessments. So this information would be used in two ways. One, to help with other practices who are interested in future programs similar to this, to say, well, what have other practices gotten out of this? It's not just the numbers, not just the milestone numbers, but, in what ways do you felt that it really benefited your practice? And then the second thing is we're contemplating adding some additional modules that would kind of be an advanced version of some of these. They would be discrete modules, so you wouldn't have to like reapply for a program or anything. There would be a training in a similar format to what you attended today on a specific topic, like care coordination. And then there would be a workflow, an optional workflow that you could work with Alyssa or one of the other MedChi coaches to come up with a workflow related to that training specific to your practice. So as the program closes out at the end of the year, we do have this going through the approval process. We're hoping to add it. It would not only be open to your practices that have been in this program, but to any practices. So, if you know anyone who is interested in a specific topic, the topics that we're considering is using CRISP and health IT optimization, implementing social determinants of health inside the practice, care coordination, care management, team-based care, which is, but a little more advanced than what we saw today, right? Because we know we did a training on team-based care. This is more, a more advanced training than what you did today. And then participating in models such as EQUIP, which is a bundle-based program that is offered through CMS and similar to the Prometheus program that is offered through Care First. So those are some of the things that we're contemplating as we come to the end of the program. But we really do appreciate everything that everyone has done. We know this has been a big commitment. So we're not looking for you to commit another 2 years. We're just for people who are interested and would really like more information on areas where they could get a little more support and resources. Again, they'll be discreet. So it'll be a training and a workflow. We'll probably do them every maybe 2 to 3 months, starting after this program ends in July. So just wanted to let everybody know about that. So those are the 2 updates I had.
Thank you, Melanie. Yeah, so if there are any suggestions for like anything you would like us to incorporate too, please send those to
Yeah,
us.
topics, you mean that? Yeah, that
Yeah.
would be great. If people have topics they'd be especially interested in.
Yeah, because I think CRISP is a huge one that we hear often. So along with some of the others that you mentioned. So I think that would be very helpful too. Again, we're here to help you. So whatever you feel would be best for your practice or something that you think would really make an impact, we'd love to hear it. Well, thank you all very, very much. I did send these slides out. They were sent separately, both the presentation for the Module 6 slides themselves, and then also the I sent an attachment for the change package too. Most of it was incorporated in the presentation that we reviewed today, but there are a couple of the change concepts that may go into further detail that you can have, you have them in your email. So hopefully you can review them and keep them if you want to look back on this information. So if you wouldn't mind, please completing the attestation for today's training. I will send the link out right after this call. And if you need me to resend the slides, please let me know. I will get those to you as soon as possible. And thank you all so very much. And I hope you have a wonderful rest of your day. And we will have our Module 7 training. I'll send those dates out by the end of the week with the link. They'll be sometime in the middle of May. I believe it was the 17th and 18th. So again, we have a 2 o'clock on the 17th and then a 12 o'clock on the 18th. So I'll get those links out to you by Friday, and that'll be our Module 7 training. And then we have our last assessment. We'll be wrapping up sometime in June. So again, thank you all so much, and I will talk to you soon. Have a wonderful day.